Welcome to the Neurology channel. Today, we're going to explore a condition that affects the brain's fluid balance: normal pressure hydrocephalus, or NPH. Normal pressure hydrocephalus is a neurological disorder characterized by an abnormal accumulation of cerebrospinal fluid in the brain's ventricles. Unlike other types of hydrocephalus, the pressure of the fluid remains within the normal range, but it still causes problems. Normally, cerebrospinal fluid cushions the brain and spinal cord, providing protection and nourishment. However, in NPH, this fluid builds up, putting pressure on the brain and affecting its function. So, what are the symptoms of normal pressure hydrocephalus? NPH presents with a triad of symptoms: difficulty walking, urinary incontinence, and cognitive decline. This combination of symptoms often develops slowly and progressively worsens over time. The first symptom is trouble walking. You might find that you're walking in a funny way, like taking small steps and shuffling your feet. Some people also have trouble with balance and tend to fall more often. Trouble walking is a common symptom of NPH. The excess fluid in your brain can put pressure on the parts of your brain that control movement and coordination. This can make it harder for you to walk normally and can affect your balance and stability. You might notice that you're walking more slowly than usual, or that you're having trouble lifting your feet off the ground. Some people with NPH also have a shuffling gait, where they take small steps and have trouble picking up their feet. These walking difficulties can be frustrating and can affect your independence and quality of life. It's important to talk to your doctor if you're experiencing trouble walking, especially if it's getting worse over time or causing you to fall. Your doctor can help figure out if your walking difficulties are related to NPH or if there might be another cause. They can also work with you to come up with a treatment plan to help manage your symptoms and improve your ability to walk. The second symptom is urinary incontinence, which means having trouble controlling your bladder. You might feel like you have to pee all the time, or you might have accidents because you can't hold it in. Urinary issues are a common symptom of NPH. The excess fluid in your brain can put pressure on the nerves that control your bladder, leading to problems with urination. You might notice that you're having trouble controlling when you pee, or you might feel like you have to go to the bathroom more often than usual. Some people with NPH also experience urinary urgency, which means feeling like you have to pee right away and not being able to hold it in. This can be frustrating and embarrassing, especially if you're out in public or trying to sleep at night. These urinary issues can be bothersome and affect your quality of life. It's important to talk to your doctor if you're experiencing urinary problems, especially if they're getting worse over time or causing you discomfort. Your doctor can help figure out if your urinary issues are related to NPH or if there might be another cause. They can also work with you to come up with a treatment plan to help manage your symptoms and improve your urinary function. The third symptom is changes in your thinking and memory. You might have trouble remembering things or paying attention to what's going on around you. You might also feel confused or have trouble making decisions. Memory issues are a common symptom of NPH. The part of your brain that's responsible for memory, called the hippocampus, can be affected by the excess fluid. This can make it harder for your brain to form new memories or recall old ones. You might notice that you're having trouble remembering things like where you put your keys, what you had for breakfast, or what you did yesterday. You might also have trouble paying attention or concentrating on tasks. These memory issues can be frustrating and can affect your daily life. It's important to talk to your doctor if you're experiencing memory problems, especially if they're getting worse over time or affecting your ability to do everyday activities. It's important to remember that not everyone with NPH will have all of these symptoms, and they can vary from person to person. If you notice any of these symptoms, especially if they're getting worse over time, it's important to talk to your doctor. Your doctor can help figure out what's going on and come up with a plan to manage your symptoms and improve your quality of life. Diagnosing NPH can be challenging due to its overlapping symptoms with other neurological conditions. It often involves a combination of clinical evaluation, brain imaging studies such as MRI or CT scans, and sometimes a lumbar puncture to measure cerebrospinal fluid pressure. When you go to the doctor because you're having symptoms like trouble walking, urinary incontinence, or changes in your thinking, they'll want to figure out what's causing these problems. Diagnosing NPH involves several steps to help them understand what's going on in your brain. The first thing your doctor will do is ask you questions about your symptoms and medical history. They'll want to know when your symptoms started, how they've been affecting you, and if you've had any other health problems in the past. Next, your doctor might order some tests to get a closer look at your brain. This usually involves getting a brain scan, like an MRI or CT scan, to see if there's any evidence of fluid buildup or other changes that could be causing your symptoms. Depending on your symptoms and test results, your doctor might also order other tests like a lumbar puncture, also known as a spinal tap, to measure the pressure of the fluid around your brain and spinal cord. Once your doctor has all the information they need, they can make a diagnosis of NPH. It's important to remember that diagnosing NPH can take time and might involve seeing different specialists or having more than one test. Once diagnosed, treatment for normal pressure hydrocephalus typically involves surgical intervention to drain the excess cerebrospinal fluid and relieve pressure on the brain. His is usually achieved through the placement of a shunt, a thin tube that diverts the excess fluid from the brain's ventricles to another part of the body, such as the abdominal cavity, where it can be absorbed. Let's talk about what a shunt is and how it's used in medical treatments. A shunt is a medical device that's used to help manage conditions where fluid builds up in the body, especially in the brain or abdomen. It's a thin tube made of silicone or other materials that's inserted into the body to redirect the flow of fluid from one area to another. There are different types of shunts designed for specific purposes. In the context of conditions like hydrocephalus, a condition where there's an excess of cerebrospinal fluid in the brain, a ventriculoperitoneal (VP) shunt is commonly used. This type of shunt connects one of the brain's ventricles to the abdominal cavity, where the excess fluid can be absorbed by the body. During surgery, the shunt is carefully inserted into the appropriate location in the body, typically under the skin. One end of the shunt is placed in the area where the fluid needs to be drained, while the other end is connected to a drainage system or reservoir that allows the fluid to flow out of the body or be absorbed. Once the shunt is in place, it helps regulate the flow of fluid and prevents it from building up to dangerous levels. This can help relieve symptoms and improve quality of life for individuals with conditions like hydrocephalus or certain types of tumors. While shunts are generally safe and effective, there can be risks associated with their use, such as infection, blockage, or malfunction. It's important for patients with shunts to follow their doctor's instructions carefully and to seek medical attention if they experience any symptoms of complications. If you have any questions or concerns about shunts or their use in medical treatments, don't hesitate to talk to your doctor. They can provide you with more information and guidance based on your specific situation. While treatment can help alleviate symptoms and improve quality of life for many individuals with NPH, it's important to recognize that the condition can have varying outcomes, and not all symptoms may fully resolve after shunt placement. Thank you for joining us on the Neurology channel. If you found this video informative, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more valuable insights into the world of neurology and brain health. Stay well and take care!